Tools and techniques for examining the macula. Examination techniques. There are a number of general tips for performing ophthalmoscopy of the macula that apply to the three different tools. Examine the patient in a dim room. This will help you maximize the view through an undilated pupil, but ideally dilate the pupils for the best view. Even very experienced eye care practitioners will struggle to examine the macula through an undilated pupil. This is because as soon as light falls on the macula, the pupil will constrict, limiting your view. Start with a low light and gradually increase brightness so that you can balance the comfort of the patient with your ability to see detail. To find the macula, first find the optic disc. Note its contour, colour and cup to disc ratio. Then look temporally or ask the patient to look at the light. This should bring the macula into view. If not dilated, the pupil will constrict and the view will be poor. When examining the macula with a direct ophthalmoscope, it can be best to start with the patient and the examiner wearing their usual distance refractive correction, with the ophthalmoscope set to 0. Use your right eye to examine the patient's right eye and your left eye to examine the patient's left eye. Position your eye at the same horizontal level as that of the patient and ask them to look at a point straight in front of them. Start from 15 degrees temporal. Stand with your feet close to the patient but lean back, then lean inwards to follow the fundal red reflex, assessing the clarity of the media. If you are following the correct horizontal 15-degree temporal flight path, you should find the optic disc. At first it may appear a bit blurred, but as you get closer it should become clearer. Use the lenses in the ophthalmoscope if it remains blurred. If you can't find the optic disc, follow the blood vessel branch arrows towards the disc. Once you locate the optic disc, move closer to the patient to get a clearer view. Comment on the contour, colour and cup to disc ratio. From the optic disc, shift temporally until you can see the darker macula and the bright foveal reflex. When using a slit lamp to examine the macula, position the patient so that their eyes are at the same level as the black mark on the vertical bar and their head is forward leaning against the forehead strap. Line up the light source and eyepieces to create axial illumination. Use your fingers to brace the position of the lens and hold the eyelid up to reduce blinking. Ask the patient to look slightly temporally towards your ear. The optic disc should come into view. Adjust the tilt and distance of your lens and the beam brightness, width and height to improve the view. Then move temporally to find the darker area of the macula. Using a binocular indirect ophthalmoscope to examine the macula, patients are best examined lying down, but sitting is okay. Make sure the indirect feels comfortable and it is aligned with your eyes so you can see your thumb in the centre of each eyepiece. Use your fingers to brace the lens at the correct distance and hold the upper lid. By asking the patient to look at their thumb and then move in the position of their thumb, you can move their gaze to allow examination of all parts of the fundus. Tilting the lens and varying the brightness of light can improve the view. Indirect ophthalmoscopy can also be performed using the light source of a direct ophthalmoscope. Placing by the side of the eye allows a monocular view, and between the eyes a binocular indirect view. This is most effective through a dilated pupil, and presbyopic examiners will need to wear near correction. At first, when using any of these techniques, it can be difficult to see the macula clearly. You may feel a bit dispirited, but with practice and mentorship, great results can be achieved.